Hello, this is Dr. Katie from Craig Chiropractic and Kinesiology, and today we're going to talk about traditional medicine versus alternative medicine, what they are and what you need to know. All right, so traditional medicine, also known as allopathic medicine, is what you think of when you typically go to the clinic or the hospital. This is where you'll see someone like a medical doctor or a nurse, and you typically will be prescribed some kind of medication. You often can get your vaccinations or shots, and this is the field where they would provide things like surgery, okay, as well as other lab tests and so forth. So that is traditional medicine. That is what you think of. Wow, I got in a car accident, I'm getting rushed to the ER. That's traditional medicine, okay? What is alternative medicine? So alternative medicine is basically one of the other major kinds of medicine. So that would include practitioners like myself as a chiropractor. This would include things like acupuncturists, naturopaths, etc. So where we fit into this is we also work in healthcare. We also are your medical providers and doctors. What we do is we do not deal with surgery, we do not deal with vaccinations, and we do not deal with any prescription medications or drugs. So we work on things like helping you manage pain with natural methods, including things like chiropractic adjustments, herbs, nutrition, homeopathy, acupuncture, etc. I think a major difference between traditional medicine and alternative medicine, also known as natural medicine, is just the different philosophies and approaches. They both have their time and place. For example, when it comes to things like emergency medicine, trauma, and surgery, traditional medicine really excels and is top-notch. What we have set up for trauma, burn units, surgery, it's amazing. We are doing, I think, pretty well in that department. An area where traditional medicine is a little bit weaker is when it comes to things like preventative medicine and also rehabilitation. Okay, they can help, but there's other limitations and what they have available for tools. Often with traditional medicine, what they mostly have at their disposal is prescriptions, which there's a time and place for prescriptions. There's a time and place for things like antibiotics and painkillers. But unfortunately, we live in a culture and a society where these are so overused and abused. And there's many other options that might be more cost-effective, number one, but even more importantly than that, they may help better with less side effects. So something to consider on the alternative medicine side, we do not deal with like the trauma, the surgeries, the immediate like accidents. What we deal with is more of the preventative medicine and the rehabilitation end of things, as well as helping along with during these times. So the types of things we work with is, hey, someone's in pain. Instead of just giving them something like a painkiller just to make the pain go away, in alternative medicine, we want to ask the question, what's causing the pain? Okay, your arm hurts. Okay, is it that maybe the arm's not sitting quite right in the socket and it needs to be adjusted? Your back hurts. Is there a vertebrae that's shifted out of place that might need to be adjusted? Oh, this muscle's really tight and locked up. I might need to work that out or help relax that. Oh, you're having digestive problems. You might have food sensitivities. Let's get to the bottom of that. This is more the focus of alternative medicine. We are very interested in root cause, not just chasing symptoms, okay? It can be very tempting in healthcare on either side to just see a symptom and want to run after it. Like, oh, that person has low back pain. We should just make the low back pain go away. Versus, what's causing the low back pain and what can we do to prevent it in the future? Both traditional medicine and alternative medicine have their time and place, but this is just a brief understanding of the differences and to know that both may be able to help you at appropriate times. All right, well, thank you for listening.